Welcome back to another video, guys. This one's going to be a little more informal. There's no patient here to talk about or what have you, but what I wanted to discuss was what do chiropractors do and what do they actually take care of? A lot of people think that we're purely just for back pain, neck pain type of syndromes. But a lot of people will be surprised to know that our history is the very first chiropractic adjustment actually restores someone's hearing. And a lot of what we do, especially in the early part of our profession, was helping people through the influenza pandemics, a lot of visceral conditions. And even in my practice, I take care of a lot of things that have nothing to do with back or neck pain, from constipation to people with seizures to hemorrhoids, diarrhea, colitis, Crohn's, you name it. A lot of those conditions can find their root in spinal nerve interference or spinal nerve irritation. So when people come to my office, a lot of times it's not for those conditions because they just don't think about chiropractic as a solution for the problem. So they'll come in with back pain or neck pain. But when I do my thorough history, I'll ask them about, hey, do you have stomach issues, constipation, diarrhea, acid reflux, those type of things. And through my history, I'll find out that, yeah, they do suffer from that. And then, knowing that a lot of times the cause is in the spine, when I check them, they get fabulous results with it. And then that's how they come to understand that, we can't help that. So when you have a problem, we always want to know, first of all, why would we have that in the first place? Medically, you go to your medical doctor and he's going to do all he can for you, but medicine is designed to treat the symptom, not necessarily the cause. So like diarrhea, they can give you medicine to slow your gut down, or if you're constipated, to speed it up, or anything under the sun they have a drug for pretty much. And all those drugs have risks. But in chiropractic, we are not going to treat the condition. So if somebody comes to me with constipation or diarrhea, I'm not treating the condition. What I'm going to do is I'm going to check the spine very carefully to see if I can find the cause or a nerve that's responsible for that malfunction. And when we correct it specifically like we do in GONSTEAD, and in the GONSTEAD work compared to a lot of other types of chiropractic, we check the spine every visit. So I run an instrument down a patient's back. It tells me where the nerve's actually being irritated. Then my hands tell me which ones are swollen, tender, and stuck, and that's what we'll adjust. And I correct it precisely how their x-ray tells me to. And when we do that, we just get fabulous results because the body goes back to functioning normally as opposed to trying to stimulate things or slow things down. Okay? So next time you guys have a problem and you think that, you got to go see a medical doctor for it, just think that could it possibly be a pinched nerve or spinal nerve irritation causing it, and maybe go consult a good GONSTEAD chiropractor. So if you guys have any trouble finding a good GONSTEAD chiropractor, please reach out to me. You can find me on the internet. You can email me at gonsteadclinic@gmail.com or my website at www.wallerchiro.com. Anyway, I hope that was informative. We look forward to the next video. Take care.